In this episode, I interview Sophia Pavia, the Trying to Conceive Nutritionist, about her own recent personal experience with a ruptured ectopic pregnancy. This condition is life-threatening, and although many don't know about it, it's more common than you would think. She shares the unexpected diagnosis, why it happened, what she went through, and advice for any woman to hopefully prevent it or what to do if you suspect it or have gone through it. Trigger warning, we do mention the loss of her baby during this experience, so just know that in case you need to protect your heart at this time. Welcome to Healthy as a Mother, the podcast for becoming and being a mother, with your co-hosts, Dr. Leah Gordon and Dr. Morgan McDermott, two naturopathic doctors who get it.
Each week, we teach you how to be the healthiest mother you can be, from fertility and preconception to pregnancy and birth prep, through postpartum and throughout motherhood, empowering you with the natural health guidance and education you're not getting elsewhere, so you can confidently navigate the broken system at large.
The real, the raw, the untalked about. And remember, this information is not intended to diagnose, treat, or manage any disease. Always consult with your doctor before making any changes. Let's take a quick break to hear a word from our sponsors. Having adequate levels of minerals and proper hydration are essential when balancing your hormones, optimizing your fertility, trying to conceive, or preparing for pregnancy. For Dr. Morgan and I, ingredient quality is of top concern, and that's why we love Relight Electrolyte Powders by Redmond's Real Salt. Relight contains Redmond's ancient, unrefined sea salt, which contains 60 plus trace minerals in and of itself. Relight powders conveniently contain the appropriate proportions and forms of calcium, potassium, chloride, and even 2 forms of magnesium, malate and glycinate. These are essential for hormone balance, energy production, and overall wellness. The best part is they taste delicious and they have so many fun flavors. My personal favorite is lemon lime, but I know Dr. Morgan loves their strawberry lemonade. Visit redmond.life and use code HEALTHYMOTHER to save 15% off any of Redmond's products, from their electrolytes to their OG sea salt, other seasoning salts, natural toothpaste, and bentonite clays. Again, visit redmond.life and use code HEALTHYMOTHER to save 15%. Here's to happy hydrating along your womanhood and fertility journey. Okay, back to the show. So excited to introduce our guest, Sophia. Sophia's main passion is empowering women to embrace their bodies and achieve their highest levels of health and fertility. To her, there is no greater thrill than hearing that a woman who's longed to be a mother has brought home her healthy baby. She earned her nutrition degree from Bastyr University, the world's foremost naturopathic medical school. There, she specialized in ovulation and fertility and learned to blend science with real-world experience to bring an expert level of care to her clientele. Over the years, she has helped hundreds of women nourish their bodies and build beautiful families. These days, she is a mother and plant mom, as well as a military spouse. All right, Sophia, thank you so much for coming. You are such a dear friend of mine and someone I look up to as a person who knows so much in this industry of helping women get pregnant.
High praise coming from you, Leah. Thank you.
Of course, yeah. And so you have so much wisdom and knowledge to share with everybody. And I want to get into that. We're going to talk about undernourishment in women, which is something we both see, I think, a lot in practice. But first, I know you had your own personal experience, and we share a lot of our own personal experiences on this podcast, as many people know.
Okay.
And I think it would just be really helpful for our listeners to kind of hear about that experience first, because as you'll go into explain, it's kind of not rare necessarily, but it's just not something that everyone is aware of.
It doesn't feel rare when it's happening to you. And that's, I think, what's really important to note about this is it's not rare, it's real. And we say that it's sort of rare so that everybody's not like freaking out that this is about to happen to them any minute. Right. But it is very real and common enough to where a lot of people have experienced it. So
tell us what it is that we're talking about and then share your experience.
So 2 months ago, I had a ectopic pregnancy that ruptured and sent me to surgery and damn near killed me. And here I am now, not dead, and telling the tale. So I'll give you guys a little bit of a brief version. If you want to hear the full version of like everything I did and all of the things, you can go to the podcast that I co-host called the Food Freedom Fertility Podcast, where I give like the fresh hot take when I was like 2 days out of surgery and share the experience very fresh. But for today's purposes, so I don't take 90 minutes to share the story. I got pregnant. My husband and I had an endometriosis excision surgery and a uterine fibroid radiofrequency ablation. For those of you that aren't surgeons, basically what that is a surgeon. My surgeon went in with like a little robot with like 4 prongs that poke holes in your belly and cut out all of the pieces of endometriosis that were stuck in various and sundry places around my abdominal cavity, reproductive organs, intestinal system, and such. And then I've had this big old fibroid on my uterus for as long as I've been a woman. So we discovered it when I was about 12 and it was really little. And then it turned into this big noisy problem in my first pregnancy. And then it turned into sort of another bit of an issue when I was immediately postpartum with my second baby. So right after I'd birthed her and was birthing the placenta, it became an issue. But other than that, she's just sort of chilling. Like I get heavier periods than most, but I'm not, living a horrible life. I don't have like many fibroids. And when I say it's big, it's like the size of like a lime. It's not.
Wow, that's pretty.
It's pretty big, but there are gals out there with like grapefruits and basketballs and like their bellies are distended and they can hardly eat because of these massive fibroids. And that's not what I'm dealing with, thank God. But a lime on an organ that's the size of a pear is sort of like big, And so
it's totally big.
Anyway, so I had this ablation where the surgeon sort of zaps the blood vessels that service this fibroid in hopes that she'll starve and die. That's not what happened. So about 6 months after all this surgery and everything, I went in, and I got the go ahead to stop preventing pregnancy and to start trying again if we wanted. And I had ovulated just a few days before that, and we had not been preventing very rigorously. So I was like, okay, well, maybe I even could be pregnant this cycle. Like we weren't trying, but we didn't like do much to prevent. And so I got a scan. I had a nice corpus luteum, looked great. And then, so the month rolls on. This was December. Christmas time was when my period was due. So Christmas Eve, I took a test, negative, started spotting that day, felt that sort of heavy uterus periods coming feeling. And then Christmas Day, it was like full flow. And I took another test and it was negative. And so I wasn't sad because it was like, it would have been fun to tell my family I'm pregnant on Christmas Day. Like, who doesn't want to do that? Would have been nice to not have to try to conceive again. Like, who wants to do that? And so it would have been great, but didn't happen. Wasn't sad. Kind of didn't give it another thought. Just maybe a, oh, well, like sort of the, oh, well, you get when like your grocery store is like sold out of the sour cream you like or something. It's like really not that bad. And so went on with life, had a full period, like multiple days of multiple soaked period products, like full period. And was the only difference is I was using tranexamic acid that cycle to try to staunch some of the heavy bleeding I have from when the fibroid. And so it wasn't as heavy as a period as I usually have, but I was using tranexamic acid every few hours. So it wasn't really that surprising, but it was certainly a full period, like multiple days of bleeding and bloating in full pads soaked with blood. So I bring this up because so many women are like, I had my period and I found out I was pregnant. And when you really dig deeper, they're like, yeah, I wiped and saw blood on the paper twice. I had my period. And you're like, no, lady, that's not a period. But, people just don't know. And they think anytime they see blood coming from between their legs, it's a period. And So I'm exemplifying what a real period is. It's actual like multiple days of multiple soaked pads. And that's what I had. So life rolls on. Now we're in the first week of January. And according to my calculations, I had ovulated a couple days prior, though I must say I didn't see much fertile cervical mucus. And I didn't track my temperature because I put my temp drop somewhere and I still have not found it, honestly, but I also haven't looked very thoroughly. So it's somewhere in my house where I don't know, somewhere nearby. So I didn't track my temperature. I was just going off like cervical mucus and sort of how my body felt. And I didn't really have much fertile mucus that cycle, which has happened before for various reasons. And I just didn't think much of it. So, anyway, a couple days go by. I feel this weird swollen feeling in my belly, which sort of feels like how you feel when like you have really bad like gas indigestion and your belly just feels like bloated and painful to the touch. And so I had that going on. And then later in the day, it suddenly became this like really bad period cramp feeling just on my right side.
Oh, no.
And was accompanied with some bleeding.
Right.
And I was very surprised by this. So I took it easy the rest of the day and tried to sort of reason it away with like, well, I was on an antibiotic for like a dental procedure I'd had. Maybe that was what was causing like the GI sensitivity. Who knows where the bleeding's coming from. I emailed a couple like doctor friends and was like, what do you think this could be? And they're like, maybe your corpus luteum ruptured. Like, that's super rare, but it can happen. And maybe it's that. But yeah, I'm like emailing with someone. They're not like, well, let's look at your blood work and how you look at everything. They're just sort of like in between patients being like, don't know. Could be this. Keep me posted. Send it off, And so that night, I'm talking to Caitlin, who co-hosts the podcast with me, is also my best friend. And I was like, have you ever had anybody have this? Like weird spotting, cramping, plus like my milk had really dried up. I was still nursing my baby. My milk had really dried up, which she's like over 2 years old. I'd been through endometriosis surgery 6 months prior. Like my milk had taken a hit like through all of this anyway. We're mostly just comfort nursing at this point. It wasn't really for nutrition. And so, but like my nipples were sore and I was like, this is weird. Like something's happening to me hormonally. So Caitlin asked me, well, did you take a pregnancy test? I said, yeah, I took two earlier, when my right before my last period, which was like just over 2 weeks ago, about 2 weeks ago was when I had my negatives and then had a full period. Like there's no way anything is in my uterus, like after that amount of bleeding and like clotting and everything else. And she was like, yeah, that's what I'm worried about is maybe it wouldn't be in your uterus. So why don't you take a pregnancy test if you have one? And I think the Lord was just speaking to her and like showing her something that I was totally unwilling to consider.
Yeah, totally.
And so I took a test and like before the pee had even saturated the whole strip, it was like positive. Hugely positive. And I was like, this test is broken. Like there's no way this could be.
Right.
And so I stick two more in that pee and they're positive. And I was like, what the hell? So I go downstairs to my husband with these like horrifically positive tests. Like positive line is darker than the test line. And so I was like, I'm pregnant. And he like laughed and hugged me and kissed me. And then we sat down and he was like, how could this be? And I was like, we're like looking at the calendar and trying to figure it out. And we kind of landed on, okay, this is one of two things. Either this is like a freak miracle from the Lord. And because we'd only had sex like one time. And that would have been like 5 days prior, like since my period. So we were like, either this is like one for the medical texts and this is like a, freak instance, or this is an ectopic and something's wrong.
Right.
And so, talking to my pretty religious family members about this. They were like, it's a miracle. And I was like,
Of
maybe,
course.
hopefully. I'd love for
Yeah.
that to be the case, but I don't know. I feel
Yeah.
like something could be off about this. But I feel like
Yeah.
something could be off about freaking everything. Okay. Once you've gone through like trying to conceive and complicated
Yeah.
birth and helping women with fertility and being in the pregnancy loss community day in and day out, like your intuition is real, but so
Mm-hmm.
is your imagination. And
Yeah.
so
And
you can't,
anxiety and
yeah,
yeah.
you can't just let, oh, I feel something be the queen of your decision making. So
Right.
I kind of was like, I'm going to do my diligence. God gave me a brain. I'm not going to
Yep.
pretend that, I can't think and I'm going to just go off of whatever mystical, spiritual connection I have with God. I'm going to also look to what I know to be true in science. And so I'm going
Yeah.
to get an HCG and I'm going to get an ultrasound to see what's going on. Because
Right.
for those of you who don't know, once your HCG reaches above 2000, there really should be something visible in your
Yeah.
uterus with our modern technology. So if your
Mm-hmm.
HCG is over 2000 and we don't see a gestational sac or a fetal pole or really just a gestational sac. We're just looking
Yeah.
for evidence of baby. We don't need to see an actual little gummy bear floating around in there because it's too little at this point.
Right.
But has your body made a sac, a placenta? Like, is there something growing? So if you suspect an ectopic pregnancy, we always look at an HCG. Is it over 2000? And imaging. Is there a
Yeah.
gestational sac within the uterus? Because if we don't see either of these things, then it's going to tell us one thing or another. So if the HCG is lower than 2000, well, let's keep an eye on it. If it's not doubling every 2 days and we're not seeing a gestational sac developing, you may have an ectopic and we need to treat that.
Yeah.
Um, if we are like, the HCG is over 2000 and we see a gestational sac in the uterus, hooray, a
Mm-hmm.
pregnancy is underway. Now,
Right.
anything can happen at any point, but we're at least got, 2 boxes checked to pregnancy is normal as much as we can at that stage of pregnancy.
Yeah.
So I didn't want to go to the emergency room because it's January and
Yeah. Ugh,
everybody's disgusting. I'm
I
sorry.
know.
Humans are
It's
gross.
it's so hard.
And it was just nasty. And so I didn't want to go there where everybody's like barfing into bags and open mouth coughing and trying to get more drugs and screaming and carrying on because they have no emotional regulation skills. And that's the
Mm-hmm.
ER's fault to manage.
Yeah.
And I didn't want to do that. So having a license here in California, I just wrote my own lab orders and went and got my HCG drawn and called up my buddy Sergio, who owns a private ultrasound
Oh, I
clinic, and
love
said, "Can you fit me
Sergio.
in today?" Oh, you know Sergio. All
Yeah,
right. Shout out to Sergio at
he's
Sono
the
Health.
best. I know. I miss him.
Anybody who is, looking for some imaging, doesn't just have to be baby.
Yep.
Sergio's the dude. So I call him and I'm like, "Are you in? Can you see me today?" He's like, "Yeah, come meet me here at noon." So I go in, and as I'm walking in, my OB calls me and she's like, it's the on-call doc from her office. And he's like, "Okay, what's going on?" And I told him, and he was like, "You need to go to the ER. Could be ectopic." And I was like, "Well, I don't really want to do that." So I drew my own labs and I'm going to go see imaging. And he's like, "That's all well and good, but what are you going to do when you see something bad? You need
Right.
somebody who can you gonna do your own, you got methotrexate in your purse there, gal?
Right.
No? Like, what are you going to do? You're going to have to go to the ER. You need to get with someone who can put these things together and treat you."
Yeah.
And I was like, "All righty, that's fine." Well, then I'm about to walk into Sergio's. And honestly, I trust him more than whoever the hell is in the ER anyway. Because, guys, the ER sucks.
I
It
know. It
sucks
really does.
bad. Nobody stays there long term. It's like where you go to, at least some doctors and nurses and stuff like thrive off the chaos and they stay there long term. But support staff, like, sonographers, respiratory therapists, like techs, they don't stay there. This is like their first or second stop after school in order
Yeah.
to get on to doing what they really want to do, like working in telemetry and cardiac or like whatever. It's like the stop you do on the way to going where you want to go, because it is brutal.
Yeah.
You're going from crisis to crisis. It's understaffed. Anyway, so I was like, I trust this guy more than I trust whoever's going to be in the ER anyway. So we go in, Sergio's taking a look. He's like, well, your uterus is empty. So let's look at your left ovary. Okay, left ovary is looking good. Okay, let's look at your right. Oh my God. Look at that.
No.
That is not good. That's a gestational sac on your ovary / jammed in your tube.
Oh my gosh.
And it's bleeding.
So
So you
scary.
have to go right now to the hospital.
Yeah, because for people who don't know, that can rupture, which it probably did with you.
It was already partially ruptured, but it's
Yeah.
only going to get worse.
And it's life-threatening at that point.
It's life-threatening. You will continue
Yeah.
to bleed until you die.
Yeah.
Because your baby is desperately trying to stay alive. Your body is desperately trying to keep that baby alive. And it's going to sacrifice you. He's going to sacrifice himself. No, Ron, you can't. This is what my body was doing, okay? It was like wizard's chess.
So funny.
In my ovary, in my tube. If you're not a
funny.
Harry Potter fan,
I
you're
know.
like...
It's like, what are you doing?
And I was like, well... do I have to go to the ER? And Sergio was like, not me, not Hermione. You have to go to the ER. And so I was like, shit.
Yeah.
So I got to call my nanny and be like, you got to stay late. I got to go do this thing. My husband's coming with me. So we go there. It's horrible. Go to a different hospital that the doctor who did my endometriosis surgery is at that day. So I go there, except she's in the OR treating other people, so she can't come see me. So I see another doctor. They do all the things and decide, because my HCG was less than 4,000 and the gestational sac measured less than whatever it needs to do, and ding, ding, their sonographer saw no bleeding and no free fluid, which was a lie because Sergio had seen it.
Right.
But this jabroni in the ER didn't see it, and our ER doc was like totally unwilling to look at the imagery that Sergio had provided.
Oh my
and
gosh,
even then,
so
it's
annoying.
like, yeah, I know. It was bad.
I've had horrible experiences in the ER as well with family members, and personally, it's just terrible.
It's a bad place to go. Depending on the situation. I'm glad it's there, but it's not well run.
Yeah.
So the doctor says you're a good candidate for methotrexate, which is a really strong chemotherapy drug that basically interrupts the process of cell replication and division.
Yeah.
So if you have a baby inside you, it will stop growing and it will die.
Mm-hmm.
And my baby had already died at this point. And so the point was for my body to stop pouring nutrients into this thing that is to this, dead baby. I hate to say it like that, but that's the truth of it. And so make sure you put a trigger warning on this, would you?
Yeah, I will.
So I'm like, okay, so what are my options? And he's like, no options. Either you take this drug or we take you to surgery right now and you lose an ovary and a tube. What do you want to do?
Gosh.
And I was like, okay, well, we'll do the drug. And he's like, okay, that's what I recommend. But I want to tell you, this is not me giving you a shot and sending you on your merry way.
Yeah.
You need follow-up because this does not always work. So I'm going to give you this shot, and it's 2 huge shots in each butt cheek. And this friggin' hazmat team comes in and because this is an extremely toxic drug.
Right.
And so they give you this shot in each butt cheek, and they tell you you have to be on a liquid diet for the rest of the week in case we have to do an emergency surgery on you at any point. You need to have a follow-up every 48 hours for the next several weeks until there is no evidence of this pregnancy anymore.
Wow.
And you have to do this. You can't not do this. You can't just take the shot and go home. You could die.
Yeah.
So I was like, okay, gotcha. So he says, okay, now you're going to follow up on Friday. This is Wednesday night. He's like, you're going to follow up on Friday. Talk to your doctor. She's in the ER right now. She's been looped in on all this. You're going to go to her clinic on Friday. Her clinic director has set this up for you. And so go in on Friday. And I had a feeling, I was like, you doctors don't know anything because you don't manage your own schedules.
Yeah.
And so you're like, yes, I'll be there. You don't know where you're going to be. You know you're going to work on Friday, right? You know you're packing your lunch and putting on your scrubs. But like where you're going, you don't know. You don't know because you're going, as soon as you walk out of this room with me, you're going to go see the baby who's not breathing. You're going to go see the stroke victim. You're going to go see the multi-vehicle crash and people's bones poking out of their skin. Like you have another crisis waiting for you one room over. And so you're not going to remember to like go to your front desk person and be like, what's my Friday like? Can you fit this lady in? You're just going to make a promise to this other doctor and say, oh yeah, send her in on Friday. I'll be here. Yeah. You don't know where you're going to be. Get out of town with that. And lo and behold, that was the case. So no one was there on Friday. No one could see me. So I ended up going back to the ER. And thank God I did, because the rupture had really started bleeding at that point. And I had hemorrhaged about 1 liter of blood into my own abdominal cavity by that point. And
oh my gosh.
So I ended up needing emergency surgery. My husband hadn't even gone with me because I was like driving to a doctor's appointment. So he's with our kids.
Right.
And the doctor's appointment office calls me and is like, I'm so sorry. Go to the hospital that your doctor's at and go get admitted through the ER and she's going to check you out. So I was like, okay. So I did it. And they found that I was bleeding internally, rushed me into surgery. My husband got there a couple minutes before I went into the OR, and they had to remove the tube. They got to save the ovary. They were able just to sort of cut off the piece that was bleeding. And then, so
they did have to remove you. They had to remove your tube.
They did have to remove the tube. Yeah. The baby was stuck.
I didn't realize that. Oh my goodness.
And want to know why? You ready for this to flip a 180 on you here? Here's the big twist, the big reveal, everyone. Okay. Remember that fibroid I was going on about? Well, Miss Thing got so big, she smushed the tube. So the tube had gotten squished. So a little bitty sperm could get up, but a big old baby couldn't get out. So that's what had happened. One valiant gentleman found the egg and made this problem. No, the fibroid is what made the problem.
Wow,
the baby was crazy. Never the problem. The baby was loved. The baby was wanted. The baby was everything. The fibroid was the problem. And so the baby got stuck. The baby got smushed. The baby couldn't make it. And the fibroid was to blame. But at the time of the surgery, my uterus was just so vascular that removing the fibroid at that point was unwise.
Yeah.
And removing the fibroid really at any point would mean a lot of things. Yeah. It would mean I would need to wait at least a year before trying to conceive. And then I would have to have a cesarean birth, which is really not too much to... I mean, Leah's done it twice. Look at this baby she's got right there.
I know. If you hear him snoring, this is... I'm sorry.
And I'm sort of like you in a way where it's like, no, not a C-section, which is like, I need to chill. You know, like people have babies this way and it doesn't have to mean so much.
I know. It's hard.
But it does mean a lot to me.
It does mean
right
a lot.
Now.
It does. I mean, it's not anything you would ever want to choose personally. At least.
But it is something that people choose. And they choose it without batting an eye. And they choose it without tears. And they choose it without fear for the future. They just like do it because their doctor's like, baby's too big, baby's too small, baby's in the wrong position. Baby is this, baby is that, I'm bored. C-section. You're too early. You're too late. I don't like your face.
It's
C-section.
true. I know. It's crazy.
Like Oprah, you get a C-section and you get a C-section. And it's like, we're sort of mocking it here, but like it has significant risks to
It
mother and
does.
baby.
And it's like, it's harder, I think, for people like us who know so much.
Yeah.
I feel like if you don't know as much about the risks and or the complications long term, I mean, like when I see a patient, let's say I'm working on gut health, the first thing I ask is, were you born vaginal, born C-section? How many antibiotic rounds have you had? Because I can tell you so easily the trajectory of the life most likely that they're going to have health-wise unless something shifts. And it is really hard being a person who knows all that and having to go through a C-section. I mean, right now I'm in the midst of doing deep dive research on the microbiome of trying to fix it, but there's vaginal bacteria that like you can't necessarily get back that are like anaerobes that are not something you can just take in a probiotic. So it is tricky, like not only for like the actual surgery, but for the repercussions of baby. And at the end of the day, for something like my situation, I mean, I honestly don't know what else would have happened. Maybe if I had had more time legally, but it's a hard thing to choose ahead of time to be like, yeah, I'm going to do that.
It is for people that know what we know and have worked in what we've worked.
Right.
Like I used to work in the NICU. Take a look around. Everyone there had induction that led to an epidural that led to a C-section.
Yep.
Pretty much all.
Yep.
Working in physical therapy, which is what I wanted to do originally before I became a dietitian. Pediatric physical therapy, 98% of the kids in there born C-section.
Yep.
Tongue ties, oral problems, food aversions, picky eating, nursing problems, C-section babies. And we are looking a little bit at like a chicken or the egg situation. A lot of times this baby was sick in utero and had issues, and so the C-section was necessary. And then what do you know? Baby had issues after birth as well.
Right.
Because it's not, just the way that it was going to be regardless of how baby was born.
Right.
But it is a lot of, it's not set in stone that your baby's going to need these things, but we just see it more frequently that that's what happens. And birth isn't broken. Letting it unfold naturally is protective of your baby. And then sometimes things go wrong and you need help. And that's what C-sections are sort of for. But not everybody sees it that way. And the whole point of this long diatribe on C-sections is that I maybe need to chill and embrace that maybe I'll have to have one to have another baby. Maybe you will too. And you had to chill to get this going on. And boy, did we watch your journey unfold and everything like that. But the point is, I just didn't want to select that unless I had to.
I totally get it.
So I didn't get the fibroid removed, nor would it have been ethical. She would have had to do like a hysterectomy. And so when I was going into surgery, I was like scared and crying because this all came to me at once. Your baby died. You have to have this surgery to save your life. You're hemorrhaging. We're going right. And it was like a NASCAR pit crew, like descending on me. They're like, what's your blood type? What's this and sign here and all these things. And like, it was crazy because and then it was like, I was in the OR within a few minutes. It went so fast. Wow. And, so I met with the surgeon and turns out she was like, no one told me any of this. Like I was in surgery with another patient when my front desk, like had somebody come into the OR and say, do you know what's going on with Sophia? And she was like, what? And it was like, no. Okay, get her here now. And so she went out of that surgery, like sewed that lady up, came and got me and fixed me. It was so crazy. But what was great is she used the same robot as I did for my endometriosis surgery. So I don't have any new scars.
That's awesome.
And they're just these like little bitty, like 1 centimeter scars. I got 3 of them on the outside and then 1 in my belly button. And so the recovery was not like a gut and cut. It was like very minimal invasive.
Good.
But anyway, so I was scared going into the surgery and I said, okay, first thing, save my life. Second thing, save my ability to have other kids.
Yeah.
And she was like, I will.
I want to cry.
I know. I was like, save my fertility.
Yeah.
And she was like, oh, don't worry about that. And I was like, well, doctor, I have had patients wake up from this surgery in full menopause because the
Yeah.
doctor took everything.
Right.
And she went, well, they didn't have me as their surgeon, and winked at me.
Aw.
And so I was like, okay. And then right after that, I had to sign a paper for a blood transfusion.
Oh my
And
gosh.
my husband was like, a blood transfusion? He's like, I'm her same type and titer. You can take my blood. And the nurse was like, I'm sorry, what was your name? Like, what? Who? Okay.
Yeah.
Thanks. We're not going to just scoop some blood out of this guy here and put it in her. You say you're her husband, and that's all well and good, but believe it or not, the blood we give to people is tested and treated, and we're not just gonna do some sort of siphon
Bloodletting.
out of the gas tank situation. But my husband has seen a lot of combat.
Yeah.
And on the battlefield, you do that.
Yeah.
And so he learned how to do that.
He's like, I can do it. I don't even need you guys.
That's what he freaking said. He's like, I can do it.
Wow.
And they're like, yeah, we've got people for that. Like, and also, like, we can't just have some guy that could have, like, diseases or whatever.
Yeah.
Like,
I mean, Mike would have done the same thing. I mean, we had the same
100%.
concern, like, because I gave birth in the middle of COVID. And, we're like, if you need blood, Mike's like, I want them to take my blood for you. It was like, but I learned then, too, about the whole process is you have to donate, because Mike donates blood all the time. He's like a super donator or whatever. And he always finds out where his blood went. And I'm like, I need you to, like, earmark one for me in case I ever need it. I'm like, I want your blood because I know you.
I know, right?
I know your life.
Well, my husband's not really candidate to give blood because he's worked in weird countries around the world and been exposed to God knows what. But, who knows whose blood I'm getting, either. But anyway, I ended up not needing a transfusion, so that's nice.
Thank good.
But so then they wheeled me into the OR, and they were brutal. They were wild in there. Like, I lay down, and the anesthesiologist looks at my giant swollen belly, and it's like, is your belly tender? And I was like, yes. And she pressed on it a little bit. She's like, does it hurt when I do this? And I was like, oh. And then she I don't remember what she said. She turned her head and was like, to somebody. And then they like leaned over me and put the mask on and just said goodbye.
Oh my gosh. That's crazy.
It was like when they saw how distended and tender my belly was, they were like, wind it up. I'm like, here we go.
Yep. Isn't that amazing that
Get this rolling.
That the anesthesia can happen that fast? That happened with my second birth too. And it's just like 1 minute you're there and the next you're gone. It's like, whoa. It's wild.
Wow, I didn't know you had to be knocked out for your second birth.
Because the baby wasn't coming and they're like, your cervix is swollen. You're literally not going to be able to have a vaginal birth. And then they're like, let's do this really calm, beautiful, family-centered C-section. I'm like, great, because that wasn't what I had the first time. And then they go to do my spinal, and the spinal doesn't work. And they're about to cut me, and I can feel it. And I was like, wait a minute, like, don't cut into my abdomen. I can feel it. And they're like, oh, really? We're going to have to put you under. So I didn't get to be present for my C-section, and my husband wasn't able to be in the room. He was livid because apparently when you're unconscious, you no longer need a support person. So a support person cannot be in the room. So he wasn't there to see the birth. Yeah, it's like a whole thing.
Man, the dehumanization of babies.
I know.
Maybe like, you don't need the support person.
I know. It's like my baby needs a support person.
Your baby. What about your baby?
I know. He was so mad. And I didn't know any of that. And so I wake up out of the surgery and I have no pain management because my spinal didn't work. I had just been put under for the surgery. So when I woke up out of that, I had no pain management. I had just had a C-section when I didn't want it. It was like a whole thing. It was really sad. Yeah. You can see
Where'd
why
you go? Were you at St. Al's or St. Luke's?
St. Luke's.
Yeah, F them.
Yeah.
I've worked both.
Well, now now we have like $52,000 worth of medical bills that our health share is not really covering. So it's been a whole thing. I know you've been through way more. This isn't about me, but just in general, I would say we've both been through some medical stuff this year, and that sucks. I'm so happy you have insurance because you're probably still on
Yeah, my husband is retired now, so we still get
But you
full
get still
benefits.
that good, thank God, because going to the ER apparently is very expensive. Know that,
Yeah,
wouldn't you?
that ER visit was $18,000
Yeah, my
that
birth
I
was
had to pay like I don't know, $300
yeah,
out
for
of that.
anyone listening, I even if you think you might not need it, this would be my advice is to just have catastrophic insurance just in case. Even if you're like healthy and you're like I don't need it, I'm never going to need it. I never go to the hospital. Things
You
happen.
never know when some drunk driver is going to smash your ass,
Yeah,
like
or you get pregnant. I mean, like, you're just having sex, get pregnant. It could turn into that. And so, yeah, that's my public service announcement. I know it's expensive. For me, we're self employed. We don't have anyone paying for insurance. So we're like, we'll do a health share. It'll be better. And they pay until they don't. And then they don't necessarily always pay a lot. Or the hospitals are marked up. Like, no birth should be $52,000, in my opinion. That's insane. But I digress. Okay, so back to you.
Come on, government efficiency.
I
Come
know.
on, lower
Come
these
on.
hospital bills.
Crazy. Okay, so back to you. So they press on your abdomen, they put you under, you're just like out. And
Mhm.
I mean, yeah, what happened after that? Let's take a quick break to hear a word from our sponsors. Did you know that 97% of women in the US take a prenatal supplement, yet 95% plus are still deficient in key nutrients? My favorite prenatal is from a company called Needed because they dose nutrients at levels to not just meet the bare minimum as most prenatals do. They actually use form of nutrients and dosages that allow mama and baby to thrive. Needed actually approached me years ago and asked me if I could help them design the perfect prenatal because they knew that the current prenatals available were not actually helping women. We spent over 3 years diving into the research and understanding what practitioners are seeing and what women actually need at this important season before we formulated this amazingly supportive option. It's no wonder over 4,000 practitioners now recommend Needed, something I am very proud of. If you have followed me for a while, you know that prenatals and optimizing nutrients starts long before pregnancy, so no matter where you are along your fertility or motherhood journey, Needed is the brand I recommend. Head to thisisneeded.com and use code HEALTHYMOTHER to save 20% on your first order. Again, visit thisisneeded.com and use code HEALTHYMOTHER to save 20%. Okay, back to the show.
Wake up as a 1-tube wonder and come home. And my nanny had watched the kids again because that was supposed to be her day off. She was at school, I think. And my husband had to, I called him when they told me you're going into the ER. I had to call him and be like, meet me at the hospital. I'm going into surgery now. His deaf ass was like, what? And I was like, come to the hospital. I'm going into surgery. And he was like, I can't hear you. What did you say? And I was like, don't say what again. Come to hospital. And so then he did. And so he had he'd just been with some friends of ours. And they were like, oh, I'm so sorry. You are going through this. Let us know if we can do anything. And I was like, you can do something. Come on over. Watch our kids. And so then they watched until my nanny could get out of school. And then she came and put them to bed and everything that night. And so then that was that. And so when I woke up from the surgery, my surgeon was like, you're fine. You're good. That fibroid has got to go. We have got to cut that bitch out of here. She is causing problems. She's what caused this.
Yeah.
And I was like, shit. So now I'm on a journey to try to heal this fibroid enough to where I can get pregnant again without having to have the surgery. I've done it twice. I mean, come on. What's one more? And technically I've gotten pregnant 3 times, but she sabotaged that third. So gonna try.
And is there more risk? Is it bigger now than it was with your previous 2 pregnancies because it had grown during pregnancy, or has it been about the same size?
It's shrank down after each pregnancy, maybe not as small each time.
But there's no risk of extra hemorrhage or anything if you have a vaginal birth?
There is. But those things can all be managed.
Yeah.
And I'm sorry, there's no hemorrhage from a vaginal birth. It's going to match the blood loss of a C-section. So you go kiss my patoot if that's what you're worried about. And then
Yeah.
I could always have my husband do a field transfer,
There
a
you
field
go.
transfusion.
Yeah. Have him like
So,
filter that blood a little
oh
bit, get some
my
of the
God.
spirochetes out of there.
Oh my God.
Oh
He
my
doesn't have
goodness.
spirochetes. Get out of here.
Just saying, if you've been all over the world, you never know.
Spirochetes are germs, just so you know.
Yeah, it's a type of like Lyme and things like that. These hidden sneaky infections. I'm sure your husband does not have that, but just saying,
Who
you never
knows?
know.
Anyway, so that's the story. And here I am now. Part of the recovery that was so difficult is I woke up from it with this rattling, wicked cough. I
Oh.
don't know what they did with the ventilator,
Oh,
but
yes, I had that too.
both my lips were split. I had a cut on the roof of my mouth, and
Yep.
then I had this deep mucusy cough.
Yep.
And coughing with a belly full of holes, no bueno. It was not easy. And so then that about 2 weeks after surgery, and I had lost a ton of blood and been on a major immunosuppressant with this methotrexate. And so
Yeah.
my kids got the flu, which for each of them was like, a couple days of like a snotty nose and a little fever, and then sort of like a cough that lingered, but not too bad. And then a couple days after they got it, I started getting a little, starting to feel like I'm getting
Shoot.
it. And I got knocked out. I mean, I got a double frontal, double maxillary, double sphenoid sinus infection.
Ugh,
It was so bad. And so I
that's
had to get
crazy.
treated for that. And then I finally started getting better, but it was a month that I was down and out.
Yeah.
And I've been fragile since. Like,
Yeah.
we had a stomach flu go through our house, and I got it worse than my kids. And so I've just been sort of delicate ever since. It's been like a long road coming back.
Yeah. And can you talk
And
to for
go ahead.
people who don't know about methotrexate? Can you share a little bit about what that means for future pregnancies? Like how long do you take
Yeah.
it, and the folic
So
acid and folate thing?
yes, I got a singular dose of methotrexate. And the way that it works, the mechanism of action of this drug, is it blocks your cells from using folate to replicate. So folate
Mhm.
is necessary in production of energy as well as in the mitosis of new cells. And so
Mhm.
when the folate is disrupted, cells can't divide. So this impacts your ability to make more blood, which is what I had to do because I lost a lot of it,
Yep.
and your immune system and everything else. And so being really depleted from all of this and then having that drug makes you just very susceptible to illness. I only got the
Mhm.
single dose, but it was a humdinger of a dose.
Mhm.
They give you a whopping dose of this stuff.
Yep.
And it takes 3 months for it to leave your body completely. So I'm still
Yep.
not out of the woods with it yet. I'm no longer, I mean, you have to kind of quarantine yourself for the first 2 weeks after you get this injection. You have to
Yeah.
use a different bathroom than your kids. You have to flush twice.
Mhm.
They don't even want you having like saliva, like getting on your kids. Like, don't give them like a bunch of kisses on their mouth or anything because you're going to be secreting
Ugh.
this drug. Your
Wow.
sweat, your pee, your poop, your vomit, your blood, your spit, your breast milk. I had to wean my daughter in one day.
Oh
I couldn't
God,
nurse her
there's so
anymore
much
after
like
that.
I mean, how are you doing emotionally with all of this?
Well, I brought her back to the breast. Thank you for asking. 2 weeks after the drug, when you're no longer like secreting it, I brought her back to the breast. I got the approval of all of the powers that be, and
Mhm.
started nursing her again. And I'm making probably like a friggin' teaspoon of milk per boob, but we're doing it. We're doing it. We're back, baby.
Oh my goodness. Crazy. Yeah. And then because of the folate being gone, you probably typically they say to wait a couple months before trying again, right? Like you
Hmm.
have to build that back up.
3 months at least. And
Yep.
so, but with everything that I went through, 6 months is what's recommended.
Wow.
So in June, we will be hopefully able to start trying to conceive again. And from now till then, it's about building my nutrition, about doing scar tissue work, about trying to get this fibroid to chill, and about just getting healthy and strong and ready for another baby, getting brave in my heart and in my emotions, being clear about what I want. I've been, I don't want to be entitled and be like, I'm owed another baby, and like we're having another baby or whatever, because no one is owed a child. Children are gifts. They are not wages. You're not owed a baby because of what you've been through, or because of what you've done. And similarly, you're not cursed and, not supposed to have one because of these things either. Right. It's a gift, not a wage. And
I love that.
Thank you. So I don't want to be entitled about this, but I've been overly superstitious, and I'm not a superstitious person. I am a Christian, and that does inform the way that I think about things, but this like sort of superstitious mysticism does creep in, doesn't it? Or you start being like, oh, I don't want to say that I want to have another baby because I don't want to jinx it. And I don't even believe in that.
Yeah.
But it's like, I don't want to like let Satan know my plans or some kind of, you just get this like weird mentality about things. And it's just our human desire to grasp and to control. So I'm letting that go. I don't need to control. I serve a God who controls. It's not my job. My job is to work hard, to steward wisely, and to give generously. That's my job.
I love that.
And so I'm going to work hard at what I know to work hard at. This is what the Bible says, whatever is in your hand to do it to the glory of the Lord. So that's what I'm going to do. Steward wisely. What do you know to do to care for yourself and for the people around you? Do that thing. Do those things. Don't be an idiot who's like, oh, well, it's all God's plan anyway, so I'm just going to do anything I want and live my every impulse and not take care of myself because nothing matters. That's not true. And then give generously. Don't hoard. Don't be a miser. Give generously as someone who has an abundance, whatever your abundance is.
That's so great.
Financially, your time, your gifts, your talents, give. And so that's what I'm doing in my fertility life right now to prepare for my next baby, and be brave and have faith. And that's what I'm doing. So we definitely want another baby.
Yeah. What are you doing? I mean, I know we had a lot to talk. We'll have to just do another episode all about undernourishment.
Freaking knew this was going to happen.
But it's okay because this is important. This is an important topic. It's an important episode. And, for other women who might be going through this is something and for people to just listen and know to help other women. Like, I feel like that communal understanding that women should have, or that we used to maybe have back in the day, where your friend's going through something and the whole community knows to be like, that sounds like an ectopic pregnancy. This is what I know. And let's have this communal wisdom is so lacking today. So even if someone hasn't gone through this,
I will say, I don't know if they were on the nose about the ectopic pregnancy. They probably would have done something super weird. And they would have been like, the gods need a bloodletting.
I mean, most likely you wouldn't
have survived. Do you remember
survived.
Back in medical school when you had to do like medical history and like learn about the history of medicine? And it was like all these crackpot like dentist barbers that were like, oh, Elizabeth has, illness.
They were giving heavy metals for treatments like mercury.
Right. And they're like, she didn't respond to her 5th infusion of mercury.
But then they did another bloodletting. But in my mind, I'm like, it's probably because they were getting the heavy metals out.
And then God took her life.
Yeah.
And we're like, it wasn't the mercury dose and then the bloodletting that did that. It was God.
I know. Well, and then the homeopathy came around and they thought that was crazy when they were like doing leeches and bloodletting and all of that. And it's just like, oh, the medical world has been through a lot of things for sure. I mean, ectopic pregnancies, back in the day, way back, I mean, you probably wouldn't have survived.
No. No, wouldn't
this
have
is the
survived.
medical
And
marvel.
isn't that crazy? Like, this is the first real time in my life that I've needed medical help.
Yeah.
Every other thing I've ever had, I've had like cavities before that, like, you get them filled or repaired or whatever. But were you going to truly die if you didn't get that fixed? I've had stitches. I've had, sinus infections or whatever, and taken medicine at various and sundry times in my life, gone to the doctor for things, and they've certainly improved my life, but I've never had it like save my life. Like, I would have
Yeah.
died had it not been for this medical intervention. This is
And
the
has
very first
anything,
time in my life that I've ever had
yeah.
that.
Has anything shifted for you since having that? I know for me, having to go through the conventional medical world as a very naturally minded person had rocked a lot of my paradigms and stuff. And I feel like I'm a different person at the end of it than I was at the beginning. Do you feel like that's shifted anything for you?
Maybe not yet.
Mm-hmm.
I don't know. Like, this is all pretty fresh, and
Yeah.
I mean, the thrill of surviving was very real. I
Yeah.
woke up from that surgery like on cloud nine and spent like a week of my life just all smiles and joy and like kissing my husband and my children, and just my mom and my community was like bringing me meals and sending me things, and I got endless
Mm-hmm.
bouquets of flowers and fresh designer pajamas, and like people were
Ooh.
showering me with love and gifts and prayers and everything like that, and it was a beautiful community and is a beautiful community, and thank you to everybody who was and is a part of that. But there was like the thrill of survival and the
Mm-hmm.
marvel at the fact that this is possible. And I don't know, like, given my husband's career and the life that I've lived alongside him, we've seen a lot of untimely death
Yeah.
and a lot of catastrophic injury.
Mm-hmm.
And so I think my paradigm may have already been shifted because have
Yeah.
been so adjacent to this at many times
Yeah.
that I don't know that something really needed to shift within me. My
Yeah.
reasons for not wanting to go to the ER were because it's icky, not
Yeah.
because I had some sort of dissonance, or that I
Mm-hmm.
was, it was some sort of crisis of belief. It
Yeah.
was, that didn't really occur for me. And my dad beat cancer this past year with
Wow.
chemo and radiation. And so
Mm-hmm.
and I've seen people do that and helped people through that. And so
Yeah.
I guess I had already had a bit of a shift, or maybe the shift had never shifted. Like, the development was always there.
Yeah.
And just in walking beside my husband in these past, 7, 8 years we've been together, and seeing so many young widows and
Mm-hmm.
lives lost for various things, and or maybe not even, because not everybody died, thank God. Like, we've got some friends that were crazy injured overseas but are
Yeah. For anyone who
alive.
doesn't know, your husband was in the military. I'm sure
Yeah.
people
Mhm.
like
Yeah, he was in
assume
the
that, but
military.
I don't think it was ever like
Look,
said
you could
explicitly.
see, I don't know if you could see this wall next to me,
Yeah.
but you could like see some of
Like
his like
tiny,
things.
like
We're
little
in the
tiny
war
scars.
room. No, this is just the quietest room in the house. I'm in here.
Yes.
But yeah, he did 14 years in the Navy, and was medically retired for a catastrophic injury that he himself suffered.
Yeah.
So I guess it wasn't, maybe a shift is coming of some kind, but I don't know. It is, to face your own mortality, but you have to do that so much in his career. Like, every time we
Yeah.
changed commands, or he changed commands, we had to like meet with the lawyer and like review your will and your trust and your last
Yeah.
wishes and your medical directives. And everything like that. And they make you make all these decisions down to like, who do you want to accompany your body when it comes back home? Who do you
Wow.
want to tell your family that you've died? Who do you want to make your medical decisions? Who do you want to make your financial decisions? Are they the same person? Like, at
Wow.
what point do you want an advance directive? At what point do you want a DNR? At what, like, what do you want this to be? Down to like, what song should be played when we're laying you in the ground? And
Oh my
like,
gosh.
they truly, like, if you're listening to this, Lady Gaga, you've got to come sing Hold My Hand from the Top Gun movie.
Right.
If
Exactly.
he
That's your
dies,
request.
oh my gosh.
Wow.
Well, hopefully he won't be dying in a hail of gunfire rescuing a hostage anymore.
Yeah.
Hopefully now he just like dies of old age. So Gaga, you're off the hook.
Yes, I
But
hope so.
but truly, when these like national heroes die rescuing these high value hostages from high profile situations, Toby Keith really does come sing Proud to Be an
Yeah.
American or whatever, like at your funeral.
Right.
This is real. So we have had to do that a lot. And then
Mhm.
we've been to services and been a part of people's things that, like, one of my neighbors passed away 4 years ago in the line of duty. And
Wow.
he was like ridiculous at the time. He was like 26 years old and he was going to like a
Mm.
training command in Germany. Like, who would think that he was going to
Right.
die in a cold weather training accident? Like, nobody
Ugh.
thought that. How could that be?
Right.
But he did. And one of the things he said is he wanted to be buried with his mountain bike.
Oh,
And so then we had to do it.
wow. Oh my
And we
gosh.
did
That's
it.
sad
Which
though.
is like
Yeah.
crazy while we're like doing this. We're like, what are we doing? But like, this is
Right.
what he said. And he was sort of like joking at the time, like talking to his brother, like after the fact. He was like, dude, I thought we were like laughing about it as we were writing that down. But he had to do it because he was changing to this command in
Yeah.
Germany. But this happens. And so I've already been close to the
Yeah.
veil between life and death.
Yeah.
And I've been with mothers as their babies passed. I've
Right.
been in the room with as this happens. And so I don't know. I guess to think of my own mortality, it has sort of given me another layer. But
Mhm.
as a mother at the same time, if I got to die trying to give life to my baby, what a fucking way to go.
Yeah.
Hell yeah. Hell yeah.
Yeah.
Take
Gosh, it's
me,
so
like, I
crazy.
was like, what a heroic, like, my husband is like, if I gotta die to rescue this target, this, or not target, hostage, not target,
Mhm.
hostage. So
Yep.
if I gotta die so that others, I mean, that's their whole mentality, so that others may live.
Right.
And that's his whole thing. And so
Wow.
if that's what I gotta do, that's what I gotta do. And
Wow.
if I
That's
gotta die
beautiful.
giving life to my baby, what a way to go.
Yeah.
We all got
Yeah.
to go somehow. And of
Mm.
course, I would love to die as a 99-year-old woman surrounded by my great grandkids and all those things. But if I have to pick a second choice, it would be so that I could give life to my children. And so
Yeah.
I am 100% going to roll those dice again. And
Mhm.
I'm going to try not to die. I mean,
Yeah.
but if I die, this episode is going to be hilarious
Oh my
and
god.
terrible.
Hilarious. I don't know if hilarious is the word.
If
You'll
I
become
die in
instant.
labor, I'm sorry.
Oh my gosh.
This is what's become of me. Okay. Have I
Yeah.
changed? Have I become something? Here's the evidence as I'm laughing at this. And
Right.
like, we've just had to face a lot of death
Yeah.
and consider it. And it's been very close. And, what a way to go. Most people die of like Alzheimer's and heart disease
Yeah.
and like boring. I would rather have a healthy baby, right? That's the dream.
Right. That's the
But
dream.
the other dream is if I have to go somehow, which bar on the Lord returning. We all do.
Yeah.
That would be the way to meet my maker. That would be,
Yeah.
one moment I'm bringing forth a life, and the next I'm gazing into the face of Jesus. Doesn't sound so bad. So
Right. Well, I'm glad it didn't
I think
happen this
that
time
is sort of,
because there
yeah.
was no viable baby, sadly,
There
and so
wasn't. The baby had
that would have been
already passed.
devastating.
Yeah, the baby
Right.
had already passed, and I didn't want to die. That's true. I
Yeah.
still don't want to.
Right.
I want to live, and I want to give, and I want to, use my gifts on this earth and steward my life and my children's lives and be a light to the dark parts of the world. And that's what
Yeah.
I want to do. But I think that has maybe been the shift in me, is like coming face to face with my own mortality
Yeah.
and being like, you know what? Hell yeah.
Yeah.
Hell yeah.
So for anybody listening to this, I will have to do a part 2. I'm just going to have you back on for the undernourishment progesterone piece because
Yeah,
it's
that
too
was
juicy.
really morbid at the end there.
No, but I love it.
But
And I wanna wrap up with this for you, for anyone going through something like this. Like maybe they just found out that they're having an ectopic, maybe they're just experiencing right-sided pain and they're not sure, or maybe they've been through
yes.
one. I mean, is there any, I know it's still fresh for you and there will be more wisdom that probably comes as time goes on. But is there anything that you would say, like if that woman was here with you at whatever stage you feel called to
100%. I'm
share?
so glad you asked. Okay, sister, track your cycle. I
Mm,
don't care if you're trying to get pregnant. I don't care if your husband's had a vasectomy. I don't care. It doesn't matter. You have to track your cycle. You
hmm
have to track your cycle. And I want you to listen to me closely when I say this. You have to track your cycle. You have to do it. You have to know where you are, because if you're just bleeding and you're like, oh, I'm having my period, humpty bump, here I go in my life, you could die.
Yeah.
This is real. And if you're bleeding at a time other than when you're on your period, this is a problem that needs to be addressed. Now, granted, most of the time it's not a medical emergency, but if you have had a positive pregnancy test and you start having bleeding, you need to go get checked out, sister. You
Yeah.
got to.
I know.
That is,
Morgan and I just recorded a bleeding and pregnancy episode yesterday, which this is so
yes.
ironic that this is coming up now. Not that they'll necessarily air right next to each other, but yeah, it's a lot to think about and a lot to navigate. So
9
what do you,
times out of 10, it's a subchorionic hemorrhage, which can
hmm
be treated with some progesterone and ALA. Or
hmm
you could even do nothing most of the time, and that's will resolve itself. But if you want to do something, there's great data behind that treatment.
right.
Or it's a cervical, vaginal, irritation, or a polyp, or, there are
hmm
many non-life threatening things that can cause you to bleed. But pretty much
Yep.
all of them need some level of treatment. And so
Yeah.
you want to go get seen for that
Yep.
quickly,
Yep.
especially if you are early pregnancy and already have that positive test.
Yeah.
So going and getting your HCG drawn and looking at some imaging will rule out an ectopic, and these are very low risk interventions. I
Yep.
don't recommend that everybody just go get an ultrasound because the wind blows, but in this situation, it
Yep.
warrants investigation. So if
Yep.
you, first step is track your cycle. If you're bleeding at a time other than when you're on your period, red flag, get help. Second,
Yep.
if you are pregnant and you start bleeding for any reason, red flag, get help. If you are pregnant and you have pain, red flag, get help. Okay, these
hmm
things need to happen. And you need somebody who's going to investigate these things with you and make sure there's not an emergency. And I
Right.
will tell you, the pain that I experienced was not the worst pain of my life. And it was
That's good to
short
know.
lived. It was short lived. It
Yeah.
was an intense period cramp for a few minutes. And
Wow.
then sort of just like a tender belly.
Yeah, because we learn in school that an ectopic pregnancy is very painful, but in our world, any abdominal pain, especially one-sided, is an ectopic pregnancy until ruled out otherwise.
Yes.
But it's so tricky because, like you said, with gas and all this stuff, there are so many things that can cause pain that
And I have
it does get
endometriosis and a
tricky.
fibroid. Like,
I
what day
know,
is there not
exactly.
pain? Like,
I
please.
know.
Okay, I'm living with this.
It's
And
tricky. They make it seem like it's so clear cut, like, well, how did you not know immediately? It's like there's so many things that are
and
in
we
that
have different
area.
pain tolerances. We
Yeah.
do. And so what
Yep.
might be, I'm not diminishing somebody else's ectopic pregnancy experience. If you were like vomiting and losing consciousness from the pain, you
Right.
very well may have been. I
Yeah.
wasn't. And
Right.
I still had a ruptured ectopic pregnancy. So I wouldn't,
Yeah.
don't be waiting for it to be the worst pain of your life. Don't be waiting for it to be like your guts are flowing out of you worth of blood. If you're
Yeah.
having bleeding, especially bright red bleeding, versus like a little bit of brown on the tissue paper. And we're talking about bleeding, not just like I saw a spot when I wiped, but
Yeah.
like you have to put on like a pad because you're going to make a mark on the chair you're sitting on.
Right.
Um, you need to get checked out.
Yeah.
So that would be the best advice. Track your cycle. If you're bleeding at a time you shouldn't be, and you know that because you track your cycle, go get help. Because even if it's like a uterine polyp, that needs to get treated. Even if
Yeah.
it's a fibroid, it needs to be monitored and treated.
Yeah.
Even if it's cervical inflammation, a vaginal infection, a bladder infection, these
Yep.
things need to be treated.
Yep.
So go get checked out, um, and ask good questions. If you don't know what questions to ask, listen to a few more episodes of this podcast. You will learn a lot about your body and you'll be much more wise when it comes
Yes.
time to communicate your needs to medical professionals, and rule out anything life threatening. It's
Yeah.
not hard to rule out
Right.
an ectopic pregnancy.
Right. Exactly. That's the beauty of it. It's not like diagnosing endometriosis, which is really tricky.
Not
An
at
ectopic
all.
pregnancy is very obvious. You just need to go get looked at.
Very obvious. I mean,
Amazing.
yeah, you can't tell from home, but the
Yeah.
testing that we have available, imaging and blood test, will tell
Yep.
you very quickly and easily, and they're relatively non-invasive. We don't have to
Yeah.
like do surgery to figure it out.
I
So
love
that's my
that.
advice for you, dear sister.
Oh, thank you for sharing. And thank you for sharing and being so vulnerable with your experience, because I know not very many people either have a platform to share or feel comfortable in sharing. And so
Of
we are more
course.
in the dark, right? As women, even as a doctor, like I've never had an ectopic pregnancy, so I can't speak from my own experience. So
Hmm.
hearing from someone's actual experience, I think, is just so helpful. And I think anyone who's struggling with this or knows of someone who's struggling with this, I think you'll be such a beacon of light for them. So thank you.
Thank you. Yes. And I am going to try to conceive again.
Yay.
We have decided we have limits to that. Like we're
Mm.
basically going to be medically healthy. So
Yep.
we're not going to like not seek medical help if I have like polyps or an infection or whatever.
Right.
Um but other than that, we're going to pretty much just try to make a baby in our love and in our home and in our marriage. And we're
Yay.
not going to go to any big lengths. We have two healthy, wonderful children already, and we just don't think that that route is for us at this point. So
Yeah.
I like to point that out when I say we're trying to conceive.
Mm-hmm.
And I'd like to leave you with hope that we are doing this, and that you can be trying to conceive and still have limits. Okay. You don't have to do everything in order to
Yeah.
be, oh, well, you tried.
Yeah.
You have to do what's right for you. And
Right.
only you can decide that. I see plenty of couples that are like, look, if it's not going to happen in the privacy of our own home, then we're just going to find another path to parenthood.
Yeah.
And I have worked with couples that are like, unless we are pushing the boundaries of science, medicine, and the very definition of life,
Mm-hmm.
I can't really say that I've tried. Unless
Yeah.
I'm questioning the ethics of what is a human and what is slavery and what
Mm-hmm.
is, life, then I can't rest my head at the end of this and say I didn't really give it a go.
Yeah.
And so everyone and everything in between, you
Yep.
get to decide what you want to do and what's comfortable for you and what you want your life to look like at the end of your days when you get to meet your maker.
Yeah. Beautiful.
So
Oh,
there you go.
well, with that, that's amazing.
Sophia's musings.
Yep. You always have the good wisdom, and you always make me laugh, even when you're
Listen.
telling a sad story. So
Can I tell them where to find me if they like this?
That was my
Okay.
next question. Please tell them all the things.
Yes, listener. I actually have a podcast that I co-host. It's called Food Freedom Fertility, and it's on all major podcasting platforms. It's where we go into, I'm a progesterone specialist, and making enough progesterone, getting pregnant, staying pregnant, enough progesterone to carry you through the pregnancy, into breastfeeding, all these things. That's what I do. And my other co-host, Caitlin, is the polycystic ovarian syndrome specialist. So together we run the gamut. We see guests. We review research. We do it all. And I also have a Instagram page where I'm giving away even more free information. It's called TTC Nutritionist. Am I? Thank you.
You are. I think you're so funny.
The things when I think I'm like really doing something great, I get like no interactions.
Oh, same. I'm just like,
and then the ones where I'm like, hey, here's the spoon. I put it in the drawer. People are like, 5 million views.
I know. It's so annoying. It's so annoying. But you're funny. I love it.
Thank you. I try to
you can't be funny if you're not funny. I feel like people are just either funny or not funny, and you're just a funny person, and I love that.
Thank you. Humor is how I deal with the darkness of the world in a lot of ways. And I love working with women who are trying to conceive, because it is light and life and hope and future and joy. It is all those things so much, but it's also death and sadness and darkness and sorrow.
Yep.
And
it sure is.
Death and life are two sides of the same coin. And so if you don't have a way to laugh, you'll just only cry. And so I like to bring light and humor to this.
I love that. Oh my God. I'm making notes here to say where we're going to get quotes. And that's one of them. As you hear my baby waking up.
One-liners. That's what I've got.
I love it. Oh my God. I'm going to just bounce. I'm going to get my leg workout in here.
Get your baby going.
Yes, thank you. If you're open, I'd love to have you back. We can talk offline.
Of course.
But there's so much more I want to ask you about progesterone and all of that. But thank you for sharing.
Yeah, how to actually help people and not just me blabbing on about my own life.
No, I love it. This is helping. This is helping.
Okay,
thank you.
Well, good.
Pregnancy loss can be devastating, heart-wrenching, and confusing. Many women and couples are left in the dark, wondering what to do next. They aren't sure what steps they should take, how to process the grief, or what avenues of health they should explore before trying again. As I have been helping women and couples for many years in private practice and through my online programs, I received many requests for more information on pregnancy loss. This is a big reason why we did this podcast episode, and it's also why I finally made my pregnancy loss guide. This 11-page clickable resource guides you through the different aspects to consider and look into after experiencing a miscarriage. I imagined one of my patients asking, "What do I need to know and do now?" And that was how this guide was created. Throughout the guide, I also share what additional support you can obtain through experts in the field, as well as my own course offerings. Everything was created to support women and couples just like you. If you want to get access to my guide, head to www.womanhoodwellness.com/loss. Again, that's www.womanhoodwellness.com/loss. I hope this serves as a beacon of hope and a useful support along your fertility journey. Sending my love as always.
Thanks for listening to this episode of the Healthy as a Mother podcast. In order for others to hear this information, please leave a review with Apple Podcasts, subscribe, and send to a friend who could benefit from this content. We're so excited to share more on becoming and being a mother next time.
And please remember that the ideas and views of this podcast are for informational purposes only and are not intended to serve as a substitute for medical care of any kind, including the diagnosis or treatment of any illness or disease. Consult with your provider before integrating this information into your own care plan. And remember, a healthier future starts now, and it starts with you.